One of the most interesting topic in the area of exercise, heat exposure, heat acclimatization, is uh, the exertional heat illnesses during training and competition. And it's not only how to prevent them, but also how we can diagnose them, what are the symptoms, and how we can treat them, especially when we have really serious illnesses. So athletes have been um, exposed to competition at very high temperatures. We had the Olympic Games last year in Tokyo. We had the 2019 Track and Field World Championship in Qatar in Doha. And in a few months, we are going to have the World Soccer Cup in Doha in Qatar, where the temperatures are expecting to be quite high, even though they have managed to move the championship from the summer that we typically are used to watch the Soccer World Cup. Now it will take place in December. So let's start talking about the different types of heat illnesses and start from something which is considered one of the probably mildest cases of heat-related illnesses, which is the heat cramps. The heat cramps, they look like a typical muscle cramp. They're very painful. They appear during exercise. And one interesting thing about the heat cramps, um, they appear to have like a wave-like um, mode, and quite often they appear in multiple muscles at the same time, and they start from one side of the muscle and they wave all the way to the other side of the muscle. They're very painful. They're usually a result of excessive sodium losses, and usually they can be treated by replacement of sodium. So those type of heat cramps are usually an electrolyte imbalance issue. However, I have to say that heat cramps is something that, and cramps in general actually, it's something that has not been studied extensively. Cramps are difficult to induce in a laboratory setting. There are some people that we know they're prone to get cramps in general, while others, they rarely do get cramps. And one of the models that has been used a lot lately is the model of electrical stimulation. So excessive um, electric stimulation of a muscle in combination potentially with manipulation of either carbohydrate stores or electrolytes to induce this type of cramps, which some people are criticizing that model as something which is not really natural and not what happens during exercise. Moving on to the next illness in intensity is what we call heat syncope or heat exhaustion. So it's characterized with a brief fainting episode, often a response of prolonged standing. So it's something that we also describe it as orthostatic intolerance. It is a result of decrease in central blood volume caused by blood pooling in the legs and the skin, and usually with combination with heat exposure. That heat exposure exacerbates this pooling of blood on the skin, and especially when this thing happens in combination, of course, with dehydration and water deficit and fluid deficit. So when these three things appear at the same time, then it's much more common to have heat syncope or heat exhaustion. The combination of blood pooling in the lower extremities, increasing blood flow on the skin, in combination with decrease in central blood volume as a response to exercise-induced dehydration. The symptoms are usually dizziness, tunnel vision, vertigo, nausea, weakness, and you might even have um, uh, get a syncope episode where people faint, and you need to, I guess you're forced to rest for a little bit to feel better. Treatment is usually with fluid and electrolyte intake. If necessary, if the case is difficult, whether people have nausea and they cannot drink, or people sometimes might faint and won't be able to communicate to be able to drink, then intravenous infusion of fluids is necessary. The recovery is fairly quick, and I would call it amazing how quickly somebody can recover after a fluid replacement. I remember a few years ago I worked as a volunteer at the Boston Marathon, and quite often we had people that they will collapse right after crossing the finish line, and we will bring them in the medical tent, treat them with intravenous fluid infusion, and within a few minutes the same people that you thought they were dying, they were up and running and going for a cool down. So remember, this is a case of fluid deficit and dehydration, and you need rest. A SADO will help, so to avoid the extensive heat exposure. Rest, if necessary, raise the legs to increase central blood volume, and fluid replacement is what is needed in that case. So going from the easy one to the more difficult one is the exertional heat stroke. This is a very dangerous and life-threatening situation. The exertional heat stroke is defined by hyperthermia, where the core temperature is in the excess of 40 degrees Celsius. So it's a very high body temperature associated with central nervous system disturbance and multiple organ system failure. It's something that can really happen due to extensive increase in body temperature. Most of patients, they are soaked with sweat, they have pale skin at the time of the collapse, even though many people say that quite often you see dry skin, hot or flaccid skin that has been also described in the literature. Mostly associated with the classic stroke and not so much with the exercise associated or exertional heat stroke. This is extremely dangerous situation. It requires immediate diagnosis and treatment as quickly as possible, that we will discuss right next. So some of the predisposing factors are, of course, strenuous exercise, hot and particularly humid environment, and humid environment because the increase of humidity eliminates the effectiveness of the most important pathway for heat dissipation, which is evaporation of sweat. And increase temperature, and some of the guidelines, they are looking at WBGT temperature greater than 28 degrees Celsius or 82 degrees Fahrenheit. Lack of heat acclimatization, and if you watch the video of Gabriella Anderson, who was the marathon runner from Switzerland, who participated in the 1984 first Olympic marathon in the history of Olympic Games for women. She exhibited a lot of those symptoms, and actually she revealed afterwards that she was not heat acclimatized. And of course, physical fitness is a very important contributor as well. So people that they have poor physical fitness are highly predisposed for this kind of very dangerous heat illness. One of the most important approaches is to have early diagnosis and early intervention. As you can see here in this diagram, it's very important to have early intervention, and the approach is to have very quick recovery of internal body temperature. The longer that somebody remains with elevated core temperature, especially when the temperature is well above 40, 41, or 42 degrees Celsius, then the risk for multiple organ failure is very big, and quite often it becomes a condition where it's super difficult to be reversed. So the question that quite often get is like, how can we diagnose quickly, and what do we do for treatment? So for early diagnosis is to measure temperature at the proper site, where we're not measuring skin temperature, rather we want to measure internal body temperature. So in these cases, the guideline suggests to measure rectal temperature, so it is very important to position a rectal thermometer in this case, measure internal temperature, so you make the diagnosis whether it is a simple heat syncope that somebody fainted and you just need to treat the fluid deficit, or whether it is a heat stroke where it's a life-threatening situation and you have to address the hyperthermia first and foremost. So second one is we have to figure out a way to cool subjects quickly and cool that quickly that we can have a rapid cooling rate, that we can drop temperature quickly below 40 degrees within a few minutes. So this diagram actually represents three different cooling rates. Cooling rate around 0.2 degrees Celsius per minute. The white data here, which is cooling rate around 0.1, and cooling rate around 0.03 degrees Celsius per minute. So as you can see, if you are doing a treatment that induces a relatively slow cooling rate, that it shows that it can take sometimes over even an hour and a half to bring the temperature from 43 degrees all the way down to 40 degrees Celsius before you can really do something. So let's check the next data from a review paper that presents all types of different methods and which one seems to be the most effective. So we have here different types of cooling rates starting from 0.02 or 0.03 degrees Celsius per minute all the way up to close to 0.35 degrees per minute. If you remember from the previous diagram, the more effective ones are the ones that are in this range, somewhere between 0.2 to 0.3. Those are the ones that they can have the very rapid cooling. So what we can see here in the x-axis, we have the comparison of multiple different ways of cooling, from ice packs in major arteries, which for some reason has been a favorite for many medics, that they like to do that, use of ice pack in different areas in the body, and as you can see, the effectiveness is not that good. And the more you move to the right, you see cold water immersion, ice water immersion in different temperatures, etc. So what we see here, that the most effective way is to really have an effect on cooling quickly somebody who is a victim of a heat stroke, it's to do ice water immersion. So immerse as big part of their body under water for as long as possible. And the target in this case is to drop their body temperature to 39 degrees Celsius, and then should be transported to the hospital. So you have to diagnose immediately on the site of the accident. You have to treat as soon as possible in the site of the race, training, or competition. And then after they reach core temperature below 39 degrees, then you package them and you send them to the hospital. You don't send them straight to the hospital, because by the time they will make it to the hospital, they will have lost a lot of time, and that lost in time might be long enough that the condition might be irreversible. One other thing that happens actually quite often during a heat stroke, subjects develop shivering because, as I mentioned earlier, heat stroke has neurological symptoms. Your thermostat or your hypothalamus suddenly thinks that you're cold, even though your body temperature, it could be 104. So what your body is trying to do, it's trying to heat up your body even more because your body feels that you're cold. So that shivering quite often can cause increase in temperature way above and beyond of the already life-threatening situation. So if you don't drop the temperature as quickly as possible to 39 degrees Celsius and then you transport, then the risk of that person not making it is even higher. So instead of telling you data from experimental cases of people that we induce hyperthermia in a laboratory, let me show you some real data from one of my favorite studies from University of Connecticut, where they follow for more than a decade this race in Massachusetts. It's called Falmouth Road Race, that has very high incidence of heat stroke. They treated hundreds of patients with heat stroke. They did in all of those cases early diagnosis with measurement of core temperature, and they all were treated with ice water immersion locally, and then they were transported to the hospital. So what is interesting is that the survival rate for heat stroke, it was 100%. So not a single person that experienced heat stroke did not end up passing away as a response to the heat stroke, which is absolutely amazing. And as you can see here, regardless whether the subjects had core temperature 40 to 41.1 or greater than 41.1 degrees Celsius, their cooling rate was around 0.2 degrees Celsius, which is considered one of the optimal cooling rates to really have a successful recovery. So some practical guys. Once exertional heat stroke is suspected, prepare to cool the patient and contact emergency medical services. Prepare ice water bath so you can have ice water immersion. Determine of vital signs. Begin ice water immersion. Try to have total body coverage, so like all the way to the neck. The more the better. And try to circulate the water, because if the water stays stable, then the hot body, the warm body, will start warming up the water quickly and being less effective. Continue the medical assessment. If possible, provide fluid administration. Try to cool the body down to 39 degrees. And then after you reach 39, you remove them from the ice water bath and you transfer them for more advanced medical support in a hospital. So in summary, it's very important to have quick diagnosis. The survival of athletes that they experience, especially heat stroke, depends on prompt recognition and most effective cooling therapy, and with ice water immersion being the most effective. And that would limit tissue exposure to high temperature and any potential damage. Thank you for your attention, and let me know if you have any questions. Bye-bye.